back in April, Betty, most advocates naturally assume that any universal healthcare funding is going to be heavily based on employers, because that's largely the way that private funding comes in now, is through employers. But Betty was hearing that I was being a little bit cautious about that, so she asked me to write a report that kind of showed both sides of that issue. So what is the definition of an employer-paid payroll tax? Any tax charged to the employer based on wages or the number of employees. The history of employer-paid payroll taxes goes back to 1937. Currently, there's a 6.2% paid by the employer. The Medicare or Social Security tax started out very low, 1% to the employer and 1% to the employee, and gradually build up. That little funny dip that you see there was 2010 and 2011, no, excuse me, 2011 and 2012, the employee part of the tax was a holiday. Medicare is currently at 1.4% for the employer and the same for the employee. Medicare started like 1966, was really up to speed by 1968, but took 20 years to get up to speed on the full taxation. Adding those together, you get something like this that adds up to the 15.3% total Social Security and Medicare that's currently being paid. Unemployment is paid entirely by the employer. Currently, the baseline is 2.1% in Oregon, but it can go up to about 5.9%, depending on the employer's employment history. I mean, if they have a lot of layoffs, they're going to have to pay a higher rate, and also based on how much money is in the fund. Oregon has a unique tax structure for unemployment where they charge, if they're running out of money, they charge a higher tax. Oregon was one of the few states that made it through the Great Recession without going negative. The Family and Medical Leave Act will start in 2022, and it has 1% total tax, 40% of that which is coming from the employer. So a question is employer provided health care as we're doing it now, is it really an employer paid payroll tax? No, it is. Courts have found it to be a voluntary agreement with employees. Even the ACA, that has some requirements on employers, they don't have to provide insurance. Just if they don't, they have to pay a moderate fee, fine. And employer contributions vary all over the place, from 0 up to 25, 30% or more of payroll. So employers are largely paying, some employers, generally the ones with high margins, pay very generous benefits. Other employers, generally companies without much profit, don't pay anything for their employees' health care. So planning for the future, there's really two ways that you can look at planning. Are you going to go for employer-based employer-based healthcare funding, or a taxpayer-based model? The employer-based model is designed to finish the trend toward employer responsibility. It says employers should be responsible, and since some of them aren't, we should make them responsible. The other side of that coin is that we need to abandon the trend toward employer responsibility because it's doing a lot of harm. So an obvious thing, if employer-based, we place some tax on the employer, and a taxpayer-based, we only place a general tax on everyone, including businesses, equally according to their income. So how do we achieve an employer-based funding model? The RAND report says, well, employers on average pay this much. And some of them pay 0 and some of them pay 22%, et cetera. If we take the average of everyone, we'll end up at about 6.5%. So let's just charge everybody 6.5%. But that creates some problems. The people who were paying 22%, the companies would get a huge windfall, and the people who couldn't afford more than 0% are going to potentially be put out of business if everybody pays the average. You've also got the problem with the RAND suggestion that has a 6.5% on payroll and also an 83% increase in general income taxes, that's technically a double taxation of workers' wages, since the employer is having to pay for it and they're also having to pay for it as individuals. Okay, so Friedman would charge, in order to try the jagged line and to get around the problem of RAND, he'd make a different rate for different types of industries, a different rate based on size, and a different rate based on whether you're a public employer or a private employer or a nonprofit, just to try to make everything closer to the averages of what people are paying. That is a problem because it gives employers an incentive to try to figure out how to game the classification system so they pay at a lower rate. It's also very complicated to understand. Another way to look at it was proposed by Robert Poland in his Medicare for All proposal, in which case that you would put a tax on employers, but the tax would be whatever you paid last year, keep paying it. That might be hard to enforce, because is it enforced under tax law? Is it, what are the laws that you have to put some teeth in that? And what happens to new employees or new employers? Do they have to pay any tax because they didn't pay a tax before? So some of these things can be kind of complicated. The windfalls and the hardships could be dealt with in a couple of ways. RAND would require that windfalls be passed back to employees, but that creates some problems, would create adverse federal tax consequences. It would leave money on the table that's going to healthcare now, and it would have the problem that it would benefit well-paid employees, since the people who are going to get the windfalls, who are providing the highest benefits now, are in fact at the top of the food chain. So their employees already have high wages, they'll get higher wages out of it, whereas low-wage employers, in order to come up with the, say, required 6.5%, they may actually have to reduce their employees' wages. So I see problems with this. Some hardships of danger of putting some companies out of business can be avoided by RAND's suggestion of 20 employees and below are exempt. I think Friedman maybe had a 25 employee limit, but this can also has its limits. It doesn't help larger, low margin employers. Hard limit gives employers an incentive to downsize and limit. And some truth is that some of the small employers are among the most profitable. So that's kind of shows the problems with an employer-based funding. But how would you go about achieving taxpayer-based funding? You pretty much have to go to a tax on income, a tax on sales, or a tax on property. In Oregon, we're pretty much stuck with a tax on income unless we can overcome people's concern about reluctance to approve sales taxes. And I might say that there's actually, that's the CBO, gives these three types of taxes, and there really belongs the fourth one, that taxes on employment, like employer-based taxes, are really not a tax based on income, based on transactions or ownership. It's not based on the income of the employer, and it's not a measure of the employer's wealth or income. So if you go with income, there's four types of tax bases that define who pays and who plays. So if you remember, unemployment taxes, they're only paid for people who are employed, and people who are not employed or who are self-employed, their income doesn't count toward it, and they don't pay taxes toward it, and they don't get any benefits. Earned income is the base that's used for Social Security and Medicare, and the income that's counted is from employment and self-employment. Earned income is a particular problem to me, and I've mentioned this before when we were talking about taxes. Self-employed people have a lot of latitude about how to characterize their income. So if you work for an employer, all of your employment income is reported. But take a look at this graph of how much income from self-employed people is actually reported as subject to Social Security. The standard game is that people, if somebody makes $20,000 a year in their own business, they pay themselves $10,000 wage, and the rest of it they report as rent income because they're renting their building to their business, or royalty income because they design some product they make. So you can see that game is played up to, and although the graph here only goes to 100,000, that game is played all the way up. This is why I really don't like earned income as a tax base, because the self-employed have a lot of latitude to underreport their income. One of the arguments, a main argument for employer-based healthcare is that a lot of people feels like it helps economic justice. But the arguments against it helps actually very few, only helps people who are employed enough and at a high enough level to get the benefit, and it creates a lot of inequality for others. Ann Case and Angus Deaton say employer-based healthcare is a wrecking ball, destroying the labor market for less educated workers, contributing to deaths of despair. So they're noting that when employers make decisions to hire, they have to consider, can we not only cover the wage, but can we cover the cost of the healthcare? And generally, and more, they're saying, no, we're going to farm this out to some other company, some self-employed person who doesn't have to pay the benefits and things, and that's what's been happening. So is it an argument for employer-based funding? There's a lot of people who regard it as being fair. I would argue that it's not fair because it's not, we've identified one of our primary goals in designing universal health care funding as being based on ability to pay. and the act of employing someone else is not an indicator of an ability to pay. They may be losing money, in fact. So basing a tax on income would be better. It also creates employer-based systems inherently create a class system where one group of people is paying at a different rate and receiving different benefits than another class. There's an argument that having employers pay makes healthcare more affordable. The counter argument to that is that employer-paid care is an illusion. The employer is just using the money that the employee earns to pay their health care. Another argument for, of course, it's historically familiar, just like Social Security and Medicare and those things. And, you know, a lot of people get their health care through their employer now. So this seems like a regular kind of straightforward method. The other argument is it's out of date. Employment is declining, and basing a funding system based on employment would lead to declining revenue for healthcare. And here is a graph that I showed earlier showing the percentage of people who get money from employment compared with people who sole proprietors, which includes people working in the gig economy, has gone up by about 15 million workers since about 1980. Argument for, it's supported by unions. Argument against, unions are changing their perspective on this. Larry Brown, Washington State Labor Council president, said in a national op-ed, unions did not serve their members well by trying to circle the wagons around an unsustainable model of employment-based healthcare. There's a lot of people who say, boy, we really want employer-based funding because it's a way that we can express our anger against deadbeat employers who aren't providing health care where other employers are. The argument against that is better to react with empathy toward employers and employees with a low margin business who just can't afford to pay that. There is a possible, it's not really a compromise, but if you use the taxpayer-based model to figure the tax so that everybody pays equally according to their income, including businesses, you can still capture money that employers are spending currently on healthcare, just by allowing them to continue voluntarily to pay a portion of the tax that would be the responsibility of their employees.
This is actually not just healthcare, but in general. This is something I've been thinking about for nearly 50 years. And, you know, there's a long-term trend to companies having fewer employees and doing more with automation and process. And the whole, you know, robotics or self-checkouts at grocery stores, all the way up and down, there's fewer and fewer jobs. I would suggest looking at tax on companies, period. Forget about employees. That seems like the fairest of all.
Well, and that's, you know, one of the concepts that I'm talking about here is that you tax companies based on their income, just
Yeah.
the same way as that you tax individuals based on their income. And that way you actually get at some of the deadbeat people, because if there's a company that has high margins, high profits, and is not paying not paying benefits, they're going to pay more in taxes
Yeah,
than
I agree.
than they would otherwise. So, I don't think there's any beautiful ways, but I'm not sure. I think my main point is that we need to look a little wider before we go straight at assuming that an employer-based tax based on the employer's wages or the number of employees. I think we should look twice at that before we endorse that, because I think there may be better methods.
We've already set a precedent for treating companies as individuals. I think there's a precedent then for taxing them that way.
I'm unclear about how you would tax a business based on its income. I just wonder how you would do that.
Well, and I made a note in the report that for a for-profit business, it's very easy.
Okay.
But then how do you, do you have any equivalent tax for nonprofits or for government?
Yeah.
It's not that there's no way to do it, but you have to make a decision. And I think for myself, I would just as soon not place any tax on government, but they basically keep paying through their employees in the same measure as they were buying benefits. And because I think it would be really a bad mistake to place that same kind of tax on government. Nonprofits can be a little harder because there's a lot of nonprofits that make a heck of a lot of profit. So how do you make all three of those groups fair is a longer story. Karen Christensen.
I think too, we have to consider, and we always talked about not taxing the low income people if we had an income tax. But how would you, there's a lot of gaming on income taxes, particularly by high earning individuals as well. How do we get those folks to contribute to the healthcare cost?
Well, I think there are things that you can do. And, in the book, A Fine Mess, T.R. Reid kind of addresses some of that. If we are going to design a broad-based low-rate tax that basically has no exemptions, it's far harder to game by trying to have a special loophole where your income isn't counted, but everybody else's is. So I think that's one of the keys is sticking to the case of, there are just not a lot of exceptions. We don't treat people who own their houses differently from people who rent, or, it's just all based on income as close as possible to what we can equalize. And that may mean that some employees get to deduct the cost of their uniforms that they have to pay or something like that for their employment. But so there probably would have to be a few adjustments, but the idea is make it as few exclusion deductions and credits as possible.
I've got a question about the business. Okay, let's say it's a hardware store. And what is its income, or what do you, because it takes in a certain amount of money. It also pays out a lot of money for the stuff it has. It has costs for maintaining the business place and employees and so forth. So you take out all of that stuff that you pay for as a business that you have to do, and then take that from what you bring in. Is that the business income that you would be taxing?
Basically, the concept that I'm thinking of is whether you're a sole proprietor or a partnership or something, there is a tax form that you fill out that that says, this is here's our gross receipts.
Mhm.
Here was our cost of doing business. Here's how much we paid out in wages, and here is our profit at the end. In the case of partnerships, that is attributed to each individual owner. In the case of Chapter S corporations, it's attributed to each individual owner. So this is the kind of, I'm looking at business income in the same way that it's reported on your individual tax return. So about something like 18% of all income in the state of Oregon in 2015 was related to business income or business profit. So I'm just saying tax that all equally, and the same way capital gains and income from rents and royalties.
So you'd be taxing that business income as a business and not as the individual owners.
The other way around. As the income is attributable to the owners, the owners are reporting that as individual income.
Okay, so the business as such is not reporting, it's not taxed as such. It's taxed through its owners.
That depends on the business structure, because if it's set up as a corporation, it's taxed different than if it's.
Corporations are a special case that we
Right.
could spend an hour on, and I don't want to. A separate thing, so I'm mostly addressing people who are not C Corps. Alex?
Yeah, Warren, so I didn't get to read the whole document you sent out, but would you, I couldn't tell if you had, if you were suggesting that if you base it on income, whether it would be off the AGI or the modified AGI. Did you draw any kind of conclusions one way or the other on that?
No, I think there's advantages both ways. The modified adjusted has a lot of advantages because it's the same scale that is used to equate the federal poverty level. So if you put exclusions based on satisfying the federal poverty level, if you use modified adjusted gross income, you're already there. You're on the same scale. But the problem is that modified adjusted gross income is a household concept instead of a taxpayer concept. So you have to, it would be a little bit more work, for instance, for the Oregon Department of Revenue to come up with a way that says, oh, wait, we got another person living at that address or something, and how to make adjustments. It's not insurmountable. Adjusted gross income is probably the easiest because modified adjusted gross income really is not much larger. I mean, it includes things like income from municipal bonds, foreign investments, things like that really are part of your household income, but aren't.
Well, didn't you also include retirement income? And as I recall, when we did our funding subcommittee, that was turning out to be a pretty sizable chunk of income, especially here in Oregon. So wouldn't we be not capturing that base? I mean, what's your thought on that?
Well, in the report, there's a paragraph that says that one of the critical things is you have to look at any universal care program and you say, what's the benefit to seniors? Are they going to no longer have to pay their premiums or no longer have to pay premiums for Medicare Part B because they'll be paid out of the system? But the key thing is that you have to match their tax with the benefit that they receive. That might make it a good thing that Social Security isn't taxable in Oregon, or it might mean that you'd have to figure out a way around that. And I'm not going to say that I know which side of the equation that they would be on. I assume that you would need to exclude some income from seniors in order to make sure that they're not at a disadvantage under universal care. And that's partly just political, because if they feel like that they're paying a higher cost for getting the same thing that they already had, why would they support it?
Right.
But it's an equation that has to be figured out, and it can't really be figured out till you figure out exactly what do they get. You know, do they get dental? Do they get, you know, because, and then you really have to design the tax. You know, I said avoid exclusions, but equity is probably the most important thing, and making sure that they get out of it what they're paying into it, into a new universal care system is important. That's unresolved, needs more numbers in order to decide how to do that.
Well, Warren, you've certainly convinced me that a payroll tax is a problem, a big problem.
Something that I made a point of in the report is, you know, it's easy for people to sit logically and say a payroll tax is a problem. But if 98% of the population is already deciding that a payroll tax is the right one, now you've got a problem of either a lot of education or deciding instead of my first choice, you know, what will pass. And sometimes you do things that aren't perfectly logical in order to achieve a result that is better than where you are.
You've convinced me anyway.
I had made an impact on Betty as well, because otherwise she wouldn't have asked me to try to list out the both sides of the issue.
Just one question. So on this question, you know, you're kind of leaving it up in the air of, you know, we'd have to see numbers on AGI versus MAGI. Are those numbers available so we'd know what the difference is in you know, what the impact would be on funding?
Well, I think they might be, but some of them, I mean, everything's available at some effort. I don't have totals on MAGI. Although I could probably, you know, estimate them pretty closely. And that's, you know, it's partly because MAGI is not a concept of the Internal Revenue Service. It's a concept of the Health and Human Services Department. So they're not working from the same database.
Any other comments for Warren, or can we say thank you very much and encourage him to? I think it needs to be. I think it needs to be developed for circulation in some form.